So here we have our heart. It is a sheep heart. Okay, so here you can see we would need to first figure out, we would look at the external anatomy of the heart, and then we would need to figure out front and back, left and right. So we'll take a minute and do that. Okay, so this is again a sheep heart. Our hearts are about the size of our fist. They're located in the center of your chest, and the base of the heart, the kind of flatter part at the top, where the blood vessels would leave the heart, is pointed towards our right shoulder. And then the apex, the pointed part at the bottom, is tilted towards our left hip. So, what we would want to look for, first things we need to do would be to identify where we have some blood vessels coming out of the base of the heart versus the apex of the heart. So, this is probably the easiest part to pick out, the apex where it's pointed down here. And then up here, we can see, I'll use our probe to hopefully let you see a little better. Here you have some blood vessels. Here we have another one. Okay. Another down here. So those are going to be the base of the heart. So that lets us know the base. So now we need to either figure out if this is the front or the back, and if this is the front or the back. Okay. What we would look for would be, since we have the base and the apex figured out, we would then tilt it so that the apex is towards the left on us and the base would be towards our right shoulder. So kind of like it's in your body. You would then look for a coronary blood vessel that runs diagonally across the heart from the upper left to the lower right, similar to what you're seeing right here. Okay. If we look at the other side and have it tilted that same way, you don't have that vessel. You have it pointed towards the apex. Okay, so that tells us that this is the front of the heart. Okay. That means that this is the right side of the heart and this is the left side of the heart. One of the other ways you can figure out right versus left is, and unfortunately you can't do this right now, but if you press in, okay, on the heart, I don't know if you can tell, hopefully you can, that I'm able to push in pretty easily on this side. And again, we said that was the right side. On this side is the left, and it's a lot more difficult to push. I'm really trying to push. It's not really giving like this side was. Okay. The wall of, and these would be the ventricles down here. The wall of the right ventricle is thinner than the wall of the left ventricle. And we'll see that when we cut it open on the inside. The wall here again on the right side is thinner in the right ventricle because that side of the heart only pumps blood to your lungs, and your lungs are on either side of the heart. The left side, however, has to pump blood out through the aorta to the entire rest of the body. So this just needs to be the stronger of the two bottom chambers of the heart because it has to pump blood a further distance. Okay. Again, here we have the front side of the heart. And we would be able to tell because of this, let me move my glove there, this vessel right here. Okay, that helped us figure out the front of the heart. Again, this here is the right side. This is the left side. Here we have the back side of the heart, the dorsal side of the heart. And again, the ventral side of the heart, or anterior, posterior, if we're going to review some terms. This would be the apex, and up here would be the base.